everybody, it's Caitlin. Welcome back to CoronaChat. Today is Tuesday, May 5th, and right now on CoronaChat we've been doing a mini-series comparing different countries' responses to the coronavirus pandemic. I explained how we were going to do this comparison starting last Wednesday back in part 1, and then in parts 2 through 4 I explained the 3 main strategies that countries have taken in response to the pandemic, which were either 1. Massive testing, contact tracing, and selective quarantine, 2. Short-term lockdown to break the chain of community transmission or prevent it from getting established to begin with, and then reopening the economy slowly with a strategy of massive testing, contact tracing, and selective quarantine, or 3. Controlled spread of the virus with the goal of achieving herd immunity. So today we're going to look at the numbers and see if there are any immediate differences that we notice between these different groups of countries. So if you haven't seen the previous videos, try to hold on to your anticipation. Go back, watch those first so that you understand what these different strategies are, because we're not going to talk about them much in today's video. So in the first video in this mini-series, I mentioned that it's kind of hard to do these comparisons because every country is different, right? In terms of the kind of age structure of the population, how old the average person is in that country, the number of hospitals that are available that can offer intensive care, those kinds of things, right? And these differences can affect how the epidemic progresses. And normally we would try to adjust for these differences to avoid drawing a misleading conclusion, right? But this takes time, and we don't have the luxury of waiting until we have a good adjusted model to make decisions. So I say that to say that what we are about to do tonight is a very crude version of how these comparisons are actually done in public health to inform policymaking. But I'll try to talk us through some of the places where a better model might make an adjustment, and how those adjustments might affect some of these results. So as we look across the results of different countries, we want to look at both the total number of deaths caused by COVID-19 and the total number of confirmed cases. The number of cases gives us a better idea of the spread of the virus and if the strategy that the country has taken is containing the spread of the virus or not. However, it's hard to get an accurate number of confirmed cases, right? Because most countries aren't able to test everyone. Not all tests are the same. Countries have different testing strategies. So we're going to look at deaths too, because since deaths are easier to count, the reported numbers of deaths is likely to be closer to the truth than the reported number of confirmed cases. So in doing these kinds of comparisons in public health, what we would do is we'd divide the total number of cases by the total population of the country, which helps us to compare across countries that are different sizes, right? 1,000 cases of COVID in the United States is really different than 1,000 cases in the tiny island nation of Vanuatu, where the total population is fewer than 300,000 people, right? So we use what we call a prevalence rate, which is the number of cases divided by the total population, to help make these comparisons more meaningful. And because we tend to end up with very, very tiny numbers if we just divide the number of cases by the population, we usually report the prevalence rate in terms of something like 10,000 people in the total population. So we would say there are so many cases for every 10,000 people in the population. And the higher that number is, the more disease there is in a given country. Now, normally to compare deaths, we would calculate what's called a mortality rate, which maybe you've been seeing in the news, right? Which is the number of deaths divided by the total number of people infected. But since we know that the number of confirmed cases is an undercount in most countries, I'm going to calculate a slightly different number for us. This is not a number that we would use in public health, but I'm going to use this particular number because I think it helps give us a better sense of which countries have a bigger burden of deaths, right? So again, using our example of the US and Vanuatu, 1,000 deaths in Vanuatu represents a much bigger burden of mortality than in the United States because it's a much bigger percentage of the population that's died, right? Okay, so for us to get this number, I'm going to divide the total number of deaths by the total population, and then use that ratio to figure out how many people you would have to pick out of the population before you found one person who died of coronavirus, right? So the bigger this number is, the less common deaths are due to COVID-19. So I'm going to give you 2 numbers for every country. The first is the prevalence. So the bigger that is, you can think of it as the worse things are. And the second number is going to be this ratio of number of people in the population to deaths. And the larger that number is, the better things are, right? So we're going to see kind of prevalence up, death ratio down, means that we've got a bad situation, and if prevalence is down and the death ratio is, we need a lot of healthy people to find one dead person, then that's a good thing. Okay, So, and to make this a little easier so we don't have to keep all these numbers rolling around in our heads, I've got our handy dandy chart here, and I'll kind of fill this in with the numbers as I'm giving them to you, and then I'll hold this up to the screen so that you're able to see it and actually look at these numbers for yourself, right? So let's start with group number. And the other thing that I should say is I have taken the liberty of adding a couple of additional countries where there are good examples to some of these groups, just to give us more countries to look at, and countries that maybe are a little different from each other, countries that either have small populations or countries that have very large populations, just so that we've got a little bit more variability, and it's less that the explanation is due to like, well, all of those are tiny countries that have very dispersed populations versus countries that have large, dense populations, right, to try to make this comparison a little easier for us. So, all that said, let's start with group one, right? When we talked about this in part 2, this was South Korea and Singapore. So these are the countries that acted really quickly to institute massive testing, contact tracing, and selective quarantine, right? So in South Korea, as of yesterday, there were 10,804 cases and 254 deaths. And this is in a country with a total population of 51.64 million people, right? So if we divide our 10,804 cases by 51.64 million people in the country and then multiply by 10,000, we see that South Korea has an overall prevalence of about 2 cases of COVID-19 for every 10,000 people in the country. So I'm going to add that to our little chart here of 2 cases. And you know what? I'm going to do these in different colors to make it a little bit easier to see. So I'm going to put our prevalence numbers in green, and let's see, and hopefully it'll be different enough. I'm going to put our prevalence numbers in green and the death numbers in black, because I think the blue won't be quite bright enough to see. So prevalence is 2, right? And then, so that means if you were to randomly pick 10,000 South Korean people, right, on average, 2 of them would have COVID-19. And you would have to pick out 200,000 people from South Korea to find 1 person who's died. So I'm going to add that number up here. I said I would do it in black, so let me add that here. 200,000. So again, I'm going to, hopefully you can see that green is our prevalence and black is going to be the number of healthy people, or people we need to count to find 1 person who's died.